from Speed Institute. I think anybody can achieve those good ranks. I solved entirely speed modules which were there, and there was a Harrison-based quick revisions, oncology based. So I studied them entirely thoroughly. And when I started to give GTs and when I started to have the more and more discussion in videos, so I was able to in my preparations.
So I bring in all the wishes and greetings on behalf of all the faculty members of Speed Medical Institute to Dr. Ratnakar Jagdale for scoring rank number 100 in medical oncology group. Congratulations to you, Doctor.
Thank you, sir.
Great and nice to have you to spare your time in your vacation as well and
Yes,
to
sir.
share valuable experiences with us.
Yes, sir.
To the students. Can we know your brief background from where you started till date, what all you have accomplished?
Sir, I've completed my MBBS from BJ Government Medical College, Pune. I've finished my MD medicine just now from Ahilanagar, Maharashtra. And this was my first attempt, very first attempt. And I've scored a rank of 100 in this session, sir. And which was, I'm entirely grateful for your team, sir, actually, because when I decided to pursue medical oncology, I was not having any idea of the subject because for the entire 3 years, I was just studying medicine, which was my core subject. So when I decided to opt for medical oncology, so I decided, one of my senior who was, she was doing DM oncology from a renowned institute. So I asked her what she opted. So she told go blindly for Speed Institute. So I joined Speed Institute and hope that's why I'm here interviewing.
Very nice to hear, and great that you shared,
Yes,
and
sir.
very happy for you.
Thank you, sir.
And also, we want to know what is the preparation strategy, what all you did, how many months you worked for this to achieve this.
Sir, actually, to be honest, I just studied for 4 months. But when I started studying, my entire focus was just on medical oncology group. So basically, when I started studying, I just had snippets from Harrison. I used Harrison as my primary source as well as Devita. I solved entirely speed modules which were there, and there was a Harrison-based quick revisions, oncology based. So I studied them entirely thoroughly. And when I started to give GTs and when I started to have the more and more discussion in videos, so I was able to find out the missing links in my preparation. So basically, for first 2 months, I was just studying theory, and then for the last 2 months, I just started giving GTs more and more GTs. I actually gave sometimes I used to give like 2 or 3 GTs in a day and review it. So thoroughly, I used to study a lot for just medical oncology groups.
Very good, excellent. How many number of questions were you able to answer in this exam, and what is the pattern of the paper?
Sir, the pattern of paper was entirely according to the platform which was I using. And basically, I used to solve 140 to 145 MCQs in the GTs. This time I solved around 148 questions. And there were 2, 3 silly mistakes I could actually, otherwise I would have gotten better rank. But it's okay, it's part of my life, so I accept it.
Okay. Doctor, what would be your advice for the future aspirants of medical oncology?
Sir, coming from a medicine background, if I can achieve it in 4 months from Speed Institute, I think anybody can achieve those good ranks. The number of students that are opting for medical oncology group, I would suggest stick to one of the resources like Harrison or Devita, as well as solving GT is very important, sir, because if you're not solving any GTs, there's no use of just reading theory. So I would suggest you solve MCQs and GTs from Speed, as well as refer to Harrison tables and Devita, which has helped me a lot.
Great.
Thank you.
Time to thank, and whom all you want to thank, you wish that they helped day one.
Actually, I would like to thank my sister, Dr. Priyadarshini. She has helped me a lot throughout my journey from MBBS. I would like to thank my parents. I would like to thank you especially for creating such a good platform for students like us who are studying remotely in some part of India.
Great, Doctor. Wonderful having you here and sharing your valuable experiences with
Thank
us.
you, sir.
We once again wish you all the very best and all the success to you for a great and amazing and wonderful, successful career in DM medical oncology.
Thank you, sir. Yes.
Wishes to you.
Okay, sir. Yes.